Hey everybody, Dr. Darren Smith here. This video is going to tell you what you need to know about chin liposuction. In a moment, I'll be joined by my practice manager, Fotini. She can help us go through the common things we get asked in consultations so that you have the inside scoop on this incredibly popular procedure. The video is full of really fun moments like this one. It goes behind each earlobe, and that's it. And they heal up in such a way that you really cannot even tell. I love it. You can't even tell. So it's worth your while. Stick around, and we hope you like it.
So one of the common procedures that we do in our office almost every day are segmental chin liposuction, whether it's just standard liposuction, vaser liposuction, face height liposuction. It's something we do a lot of.
We
And,
love it.
so when the pandemic was still, rampant, thank God we're out of that. But, people were okay with wearing compression garments at home or wearing masks, like they could conceal things. So now that that's pretty much over, a lot of people have questions about how soon can I go outside? When do I get stitches out? How long do I have to wear this thing? How long until I see results? I have to do an office meeting. I have to go on Zoom. So we're here to just let everyone know what we really need to do after chin liposuction, no matter what modality you're doing it with.
Yeah, so great questions. And, these are things that we hear a lot. We do a lot of this procedure. The bottom line is that chin liposuction, no matter how you're doing it, is actually really easy to recover from. There's really no actual downtime. You'll feel fine afterwards. You can go right back to doing your thing, but you are going to look a little ridiculous afterwards. You're going to have to wear this white compression garment that kind of wraps around your head for 48 hours, depending on whether or not we use energy, and we can talk about that. But if we're not using energy, it's just 48 hours and you're done. So really, we say 48 hours of social downtime. So a lot of our patients are kind of busy office people, and they'll do this on a Friday, and then they can get back to work on Monday. That's a really reasonable expectation.
Yes. And speaking of energy, everyone's probably thinking, what do you mean by energy? So it really is tailored to the patient. There are patients with good skin elasticity that, the skin just snaps right back after this procedure is over. Within a week, they're seeing results. They don't have to worry. The fat's removed. Within a month, they're seeing it. There are other patients that are in the gray area that don't have, too much skin laxity, but they could use a little bit of tightening when they do the liposuction. So those would be, candidates for vaser. Patients with significant skin laxity with fat as well, you won't really appreciate the result if you just do liposuction because you're just deflating a balloon and then the balloon's going to shrivel. So how do you, Dr. Smith, how do you tailor to who needs what and what's a good idea and what are your markers for that stuff?
Yeah, exactly. And it's really important that, this is approached the right way. When we talk about kind of contouring the neck and jawline, there are two main things that we look at. We look at how much fat is there? Is there extra fat that's kind of getting in the way of seeing a nice shape? And is there loose skin? And if we get the sense that someone has nice, tight skin, all we need to do is remove the fat. We do that with simple, straightforward liposuction or tumescent liposuction. If, on the other hand, we find that someone has loose skin, if it's really loose, then we shouldn't be doing a minimally invasive procedure at all. If it's really loose skin, then we need to talk about a neck lift. But fortunately, that's kind of the minority of cases. But if someone has mild to moderate skin laxity or loose skin, we can treat that very effectively with energy. And the energy that we use for this most frequently is radio frequency energy, bipolar radio frequency energy. And this is a device called FaceTite. And that very thin prong goes under the skin through one of our three little incisions. The bigger one goes over your skin. And if Fotini's hand is your skin, you can imagine that it's actually passing energy across your skin from one probe to the other, heating the skin and making it contract in a very controlled way. So that's our go-to for kind of mild to moderate skin laxity in the neck. Another kind of energy that we really like to use, and this is something that almost anyone can benefit from, is vaser. And vaser is ultrasound energy. And this is a probe that also goes through one of our three small incisions, and I'll talk about those in a second. The vaser device emits ultrasound energy in the deeper tissues. So while the FaceTite is great for skin tightening, vaser is good for kind of deep tissue tightening, and I like it a lot for that. It also, by emitting ultrasound energy, literally shakes fat cells free from connective tissue and other fat cells. So when we go and suction them out, it's much less traumatic. There's less bleeding, there's less bruising, and it's kind of a faster, more comfortable recovery. That's what we found with the vaser device. The three little incisions that I mentioned, The great thing about chin contouring is we can do it in a virtually invisible way. Each incision is smaller than a pen cap. One goes right there, and one goes behind each earlobe, and that's it. And they heal up in such a way that you really cannot even tell. I love it. You can't even tell. Rock out. So we do it in such a way that you can't even tell anything was done, except for the fact that you'll have awesome results. So, I mean, I think that kind of covers a lot of the things that we see and hear about chin liposuction. What else do people ask us?
Okay, yeah. So patients come in when they have their chin liposuction procedure. We say the same thing to everyone, and though not everyone remembers what we say. So for the first week, you are bigger than you are right now. At 1 week, you will come in to have your sutures removed and say, I look exactly the same, doc. What did you do? By the third week, you really start to appreciate the results. And ironically, we end up seeing you at the 1 month mark. So we have patients coming in that are like, it's looking nice. Like, I'm really happy. And we're like, and it's just starting. So, Doc, why don't you go into more detail about when the final result comes in, when you start seeing stuff, and just branch it out for us.
So one of the really common questions we get is, hey, when am I going to see the results? And like Fotini said, for the first week or so, you're going to be swollen. You have numbing fluid in place, and there's just swelling from having had a procedure done. So after that first week, you'll go back to looking pretty much like you did before we did anything. It's really at 2 or 3 weeks where you're going to start to look in the mirror and be like, oh, yeah, that looks kind of neat. And it really takes about 3 months to see the majority of the result with these procedures. And, you could even continue to see improvement for up to 6 months, especially after these energy-based procedures, because it really does take time for that collagen and elastin to grow and for everything to kind of shrink down and really wrap itself to the contour that we achieve. So the expectation should be nice, subtle change after a few weeks, but full dramatic result does take a few months.
So, Dr. Smith, a lot of patients ask about when they can start resuming physical activity, whether it just be walking, running, Pilates, Orange Theory. A lot of patients want to get back to their, high intensity workouts. So what's the timeline for these things?
Yeah, so it's different for everybody, but for the vast majority of people, I will let people get back to a light workout at 4 or 5 days and a full workout after 2 weeks. So it really shouldn't take too much of a bite out of your workout schedule. So yeah, I think we've addressed, a lot of the common questions we get during these chin liposuction consultations, but please get in touch or hit us up in the comments and let us know if there's anything else you'd like to know about chin liposuction. So thanks for tuning in, and don't forget to like this video.